Hello, my name is Honorati Masanja. I'm the director of the Ifakara Health Institute and the PI of the NBirth study in Tanzania.
Hi, my name is Professor Karim Manji. I'm a pediatrician and neonatologist working at the Muhimbili University of Health and Allied Sciences.
My name is Josephine Shabani, a research scientist and statistician from Ifakara Health Institute, Tanzania.
My name is Donald Shamba. I'm a research scientist working with Ifakara Health Institute in Tanzania.
My name is Nahia Salim, a pediatrician and a researcher working with Muhimbili University of Health and Allied Sciences, and I'm also collaborating with Ifakara Health Institute in Tanzania.
I got involved in the NBirth study to make the voices of the voiceless be heard, that is, speak up for them through numbers.
As you know, every newborn matters, and we are the ones who can make the difference. As a neonatologist, the only cry I would always want to hear from a child was the cry when the baby is delivered. That cry of a delivery cry is music to the ears.
So in this study, Muhimbili University led the clinical part and the Ifakara Health Institute led the research part. So the skill mix, the expertise and qualification is one of the things which made me more proud.
A team that we had of data collectors who managed to observe over 10,000 deliveries in 1 year.
So we are not only numbers, quantity, but also a great quality team. I call our team the A team.
It's always teamwork, teamwork, teamwork. So we had a very good and excellent team, not only within the country in Tanzania, as well as across the countries from Bangladesh and Nepal and London School.
So we had a huge chance to learn from teams in Bangladesh and in Nepal.
And one thing I remember from Bangladesh, they had a very good skills for electronic data collection application. So I learned a lot from them.
Basically, it was a high level of your mutual respect for all team members that were involved. So this was, for me, was a very important thing. It is an important step to be able to measure maternal and newborn indicators. So having results like what we have, I think it is very, very important for WHO, for UNICEF, and also for countries.
If you look at the results of this study, it's important in order to progress towards the Sustainable Development Goals as well as global strategies.
The NBirth study in the last 5 years has been a journey of its kind.
It was a wonderful journey from 2016 to 2020, and it feels great to be a part of this.
We value the partnership that it has brought in between countries as well as academia and national stakeholders.
It was wonderful working with such an experienced application development team, as well as research team from ICDRB and colleagues from Ifakara and London School.
It has been a great learning opportunity between countries and also an exchange information between Global South and Global North. This study by itself is a perfect example of decolonizing global health.
I'm privileged to be a part of this NBirth study. I have worked in implementation research as a database manager. However, this application-based NBirth study was very interesting to me. So this study has helped me develop my database management skills, as well as this study gave me an opportunity to how to strengthen skills regarding the leadership quality. The result from the NBirth study can be used as an evidence to strengthen the health management information system, and this will be helpful for policy making in maternal and newborn health.
In the last 5 years, the studies have shown a landmark results in terms of how to improve measurements, including health information system as well as large-scale survey for better measurement for mothers and newborns.
was a journey. It was an adventure, and a lot more than just a study. We gave a lot of effort and time to do things well and with the highest level of quality. INAP has proposed 5 core indicators, which we can use to track coverage of key maternal and newborn interventions.
ENBIRD study intended to generate some evidence regarding the validity of the proposed core set of indicators.
Yes, it was ambitious, but fortunately we delivered. We observed more than 23,000 births, 800 kangaroo mother care practices, and 1,000 neonatal infection management practices across 3 countries and 5 hospitals.
As a member of the data management team, it was our goal to develop the app for the 3 countries based on their needs and implement the system to sites.
I'm also proud that the Bangladesh team successfully led the work of developing and managing the eData app and for conducting the analysis.
Personally, I started to realize the importance and the strength of qualitative data and learned how to design and develop a beautiful app for collecting data.
I remember the hours after hours of work spent by the team on every small detail, trying to resolve issues pragmatically. We were dealing with a very, very complex data set.
I can still recall the first design workshop in Windsor. I've been a part of this team since then. We have designed the data collection tools, the data collection application. We collected the data, and now I'm absolutely thrilled to see how it all has come together.
And then the final output makes me proud of the team. It was just not the team members from Bangladesh, but also all those from Tanzania, Nepal, and London. We gave our heart into this and became and remained friends.
It was a wonderful experience to work with team. London School and country sites help us a lot to make this happen.
I'm proud of our team members from Nepal, Tanzania, UK and Bangladesh for their spontaneous effort throughout the project. ENBIRD has a very complex dataset and there were lots of challenges at every step of data management and analysis. But no matter what obstacle we faced, we were able to tackle it and complete our goal. This would not have been possible without everyone's expertise and sincerity.
I believe the next generation of researchers have more opportunities to learn from all the available resources. In our team, it was the young people that did most of the heavy lifting, frequently falling, but learning also on the way.
For me, it was a huge opportunity which will help me to lead my future research work.
We need to create more knowledge sharing platforms where these next generation researchers can share their queries and learn from the more experienced people.
I am fortunate enough to work in this project under the leadership of Professor Joy and Dr. Shams. I've learned from them how to lead a complex multi-country study starting from its design. And most importantly, I've learned from them how the findings of a research can generate recommendations which can be translated into action.
Finally, I want to thank the principal investigators for involving me in this study. I believe we together will be able to use these findings to improve the routine measurement.
I think this launching event is the perfect platform to celebrate all that has been achieved.
I've always been very interested and involved in measurement issues around maternal newborn health, and then the study presented an opportunity to make a real change. And I'm glad that I got involved with the study with our team.
How do we feel? We feel relieved, we feel happy, we feel proud. But more importantly, we feel accountable. We feel accountable towards those women who allowed us to observe one of the most delicate and personal experiences in life. We also believe that we should hold the policymakers accountable to use this evidence and to make meaningful changes in the current policies and practices. If we can do so, and when we can do so, we will be justified with our celebration. Thank you.